I'll start with the typical acne experience. So you're a teenager, you have acne, and you're trying to look good for your prom or your upcoming graduation pictures. So where do you go? You go to your favorite acne expert, the over-the-counter market. You go to the drugstore and you find this, an overwhelming number of products lining shelves with varying prices and colors. And so what are you supposed to do and how do you navigate this market? You try to Google it, and every web page is telling you something different. So you leave confused to return to your confusing homework. And this is why teenagers have angst. In all seriousness, the over-the-counter market represents a large industry with an anticipated market size of $383.6 million. This market is pretty heterogeneous, meaning there's a lot of different ingredients from approved drugs to cosmeceuticals. And these come in at various prices. So patients are frequently going to this market because it's convenient. And then they come to you, your dermatologist, wondering, is this the product I should be using? Is it worth it to be paying this price for this? Do I need to be paying a lot in order to treat my acne adequately? And so not only is it important that as dermatologists we're prepared for these questions, but occasionally we also refer to this market when prescribing an acne regimen. So our goal was to get a better sense of what patients are seeing. Specifically, we analyzed the distribution of ingredients and price for over-the-counter acne products, with the specific goal of also providing clarity on affordability and availability of these over-the-counter ingredients, specifically those with evidence-based efficacy. So we did what a lot of patients are doing. We Googled it. Specifically, we looked at 4 key search terms, including acne, acne treatment, top acne treatment, and best acne regimen. And then we looked at all those different websites, pulling the top 100, and then pulled all the acne products, their price, and their ingredients. Specifically, we focused on those that had been reviewed within the AAD clinical guidelines. And then we also performed a multifactorial ANOVA to assess for differences in price among ingredient categories. So our results are pretty incredible because just from those 4 search terms, we found 272 unique acne products out of the 400 websites examined. And price was pretty varied among products. So as a cohort, the mean was $24.79 with a standard deviation of $31.84. And the median was $10.40 with a range of 28 cents to $166 per ounce. So if you were to Google acne and look at the products yourself, you would notice a couple things. One is that there's a lot of different topical ingredients available, as displayed by the x-axis here. The second is that there's really a couple ingredients that make up the majority of the ingredients available. Specifically, salicylic acid and glycolic acid make up about 50% of products. Now, if you were to go online and to buy a product at random, you would most likely end up with salicylic acid because it is in the majority at 36%. Hidden among these are 2 ingredients, benzoyl peroxide and adapalene, that do have a grade A level of recommendation, and then compose the minority at about 12%. The next thing that we did is we looked at individual topical ingredients. Specifically, we've organized this graph so that on the left is highest median price, and on the right is lowest median price. So what you can appreciate is that if you compare among different topical ingredients, so the left side of the graph to the right side of the graph, median price per ounce ranges a lot. So it ranges from $8.15 to $65.50. And then if we were to look within a specific topical ingredient, so I have highlighted here benzoyl peroxide as an example, the price that you're paying for your product can vary very dramatically even though you're getting the same topical ingredient. So you could be paying less than $1 per ounce to more than $100 per ounce. The other thing I want to point out is that adapalene, the other ingredient with a grade A level of evidence, is about the middle of the cohort at $18.74. Things that you may notice is that there are certain product categories that fell well above the median for the cohort. Specifically, tea tree oil, resorcinol, and retinol all had much higher median prices compared to the approximate $10 for the cohort. And unsurprisingly, within our analysis, these specific product categories were more expensive and had a statistically significant difference in price. So what does our study highlight? So overall, the minority of products contain a grade A level recommendation, specifically meaning that they have either benzoyl peroxide or adapalene. This is important because this grade A level of evidence was earned through having adequate clinical trials. Now, salicylic acid, again, is in the majority, and it doesn't have the same level of evidence due to having limited clinical trials demonstrating its efficacy. All other topical ingredients fall into one of three categories. One category is insufficiently studied, which is what retinol falls under. So retinol, even though it is pharmacologically derived from retinoids, is known to be less potent and does not have the same data to support its efficacy. Sulfur and resorcinol fall into the second category. These ingredients have been around for longer, but have insufficient evidence to say whether or not they are effective. And the last category are medications that do have some data, but not at their over-the-counter strengths. Specifically, azelaic acid has a grade A level recommendation at its 20% prescription strength, but not at its 10% over-the-counter strength. Then glycolic acid we know can be effective as a chemical peel for comedonal acne, but it does not share the same data for its over-the-counter formulations. The other key highlight of our study is that products with a grade A level of recommendation are affordable. Specifically based on median price, benzoyl peroxide was the most affordable among the cohort, and the lowest cost product within this topical ingredient category came in at 91 cents an ounce. And then adapalene, again, is the middle of the group, and it's worth noting that it is more affordable compared to some other topical ingredients that don't have the same peer-reviewed data to support their efficacy. So in conclusion, benzoyl peroxide and adapalene should remain the ingredients of choice when turning to the over-the-counter market. Now, it's important to note that products with the same topical therapy can vary pretty dramatically in price. And so knowledge that these products, specifically benzoyl peroxide and adapalene, are in the minority but can be affordable can help both patients and providers better navigate the over-the-counter market.